let me begin by saying how honored and thankful we are for your presence. Let me welcome our international delegates and the tremendous audience. May I request Kiran to join us on stage? Kiran, so happy you're here. Please join us. And I'm sure the audience will note the female ratio on the stage and really look at this as a symbol of women empowerment. May I have my slides? And with this, let me begin with humility, with gratitude, with excitement for the future and for the power of the intellectual prowess sitting in this room and the many, many who are connected. Because besides all of you, I think we have almost 7,000 people already connected online watching this live. It behooves us to find a way to spread this knowledge. May I have my slides, please? We are here today in what would have been the 15th edition of this conference. When we began the International Health Dialogues, we were committed to the ideology that by speaking together, by sharing thoughts, by finding ways, we could enable greater health access. We could strive for health equity, and there is nothing more important than finding ways to get everybody health care. We are truly the architects of future healthcare. And what was once a dream, so many dreams of individuals in labs, will now become a reality. As we see this, the morning dew has cleared from my autonomous mini drome. My selfie mirror has showed me the plan for the day. And I'm reminded that it's time for my gene editing to get quickly done because I just had a heavy dinner last night. So I need to take away some cholesterol. The year is 2050, but perhaps if we work together, it could be 2030, and maybe it could be 27. Look at the wondrous creations of the mind. Sora from OpenAI is creating videos in second. CRISPR is changing your gene. We're finding ways to create synthetic organs, faster planes so that patients will be easily able to travel anywhere. And it's highly likely that all this knowledge will move rapidly and make us and the effort something that we can dare to dream that everyone in the world will have access to healthcare. Loka samasta sukhino bhavantu, meaning let the whole world be happy. And as my father and our chairman says, healthy and happy go hand in hand. So let us act upon this desire and this ability and fulfill this message that we have over the ages that we must make the whole world happy. I'm beginning with this slide because I truly believe what is said here, that sometimes decades pass and nothing much happens. And sometimes weeks pass and a whole decade has changed. Whether it's the way we're doing finance, whether it's the way we're accessing data, and the speed of change and the adoption of society to that change is accelerating and demanding so many things from us. My talk today is showcasing not what may come, but what is already here. And we're just beginning to understand the possibilities and the potential of how we can use technology to improve lives. The era of AI is upon us. The evolutionary leap in the integration of this innovation is upon us. And it may sound like hype, but believe me, this hype is actually an underestimation and an understatement of the reality that is coming. And why do we need it? Because so much in healthcare, so many people are denied care, so many people need more. We have physician shortages, we have an aging population growing, we have a workforce shortage. Multiple things are pushing us. We have children who are dying who should not be, and the number of cancer cases growing exponentially. We had 6.4 million deaths during COVID. Who knows what the next pandemic is? And 70% of healthcare costs are attributed to chronic disease and non-communicable disease. Can we find answers? Can we change? Can we be more prepared? And how can we do this together? These are the current and future healthcare challenges focused around enabling health equity. Everybody must have access to healthcare. And technology and patient safety are seminal thought process in the evolution of health equity. This truly is where the rubber meets the road and reality comes in and touches our patient lives. And this is what we need to look at. It may be a steep objective, but we have our priorities. We know what's actionable. We understand the need for lack of data, which was beautifully brought out by Dana in our earlier speech. The internet divide. We may talk about robotics and connected care, but does everyone have internet? And will AI enable healthcare or widen the gap? How do we change these to create health equity? That's what we need to do, and that's where we need to go. Because technology is truly at the heart of the ability to transform and enable access. Whether it's telemedicine and we're reaching out, e-prescriptions, doctor-patient communication, patient monitoring, big data and what we can do with it, AI, pathology images. Imagine if every single pathology image that was ever taken never missed a diagnosis. Just imagine, and we can do that. Not because AI is going to give you the answers, but AI will help the human being give you the answers. The Internet of Things, the Internet of Medical Things, VR. How beautifully can we explain what a colonoscopy is to a patient if we gave him VR? And that virtual reality, wearing those goggles, would completely demystify and explain to them why it's important to do your colonoscopy every 2 years if you're in that susceptible group. Many of these patient and doctor communications will enhance. And finally, dear friend Alexa, prompting us everywhere. Time to take your BP medication. Let's improve medication compliance. Make sure your Fitbit is giving you or your watch is telling you that you've achieved your 10,000, 12,000 steps. This ability to take data into language, insights into actionable nudges, is the transformation of patient compliance and a deeper relationship between the patient and the doctor. These are the tools in front of us. How are we going to use them? Technological innovations in healthcare, whether it's the digital patient record, which is giving you all this data, exoskeleton, which is taking a person who hasn't walked in 3 years and suddenly they can walk using this, or robotics. Each one of these is transforming. And then we're connected because it's not just the biology or the gene, it's not just the bandwidth or the connectivity, but it's the combination of biology, bytes, and bandwidth, which will create an ecosystem or a platform for transformation. And then you have privacy. Is healthcare going to use blockchain? How will we enable this? And going further, you saw what Elon Musk did in wearables. He put an implant into the brain. Maybe we don't want to be so invasive, but truly, orthopedic implants for sensing load, intraocular pressure sensors to tell you early about glaucoma, smart coronary stents. You put in a fantastic stent, you revascularized, but how do you make sure it's not blocked again? Each one of these, and of course glucose centers, 85 million diabetics in India, how can we help them further? Neural probes, radiology is changing the way we're accessing and clearing organs and vessels. Each one of these. And the tremendous thing which happened in telemedicine. Last time at the conference, we missed 2 years because of COVID. But somebody told me, ma'am, you speak about all these high-end things. Tell me what's practically happening. So you will see in this, at the bottom, in white, I quickly put a few of the things that we are doing. So if we talk about telemedicine, we have now completed over 17.8 million teleconsults of a fulfilled cycle, not a reach out. The reach out or Ask Apollo, which is AI-enabled, has 19 times more than a complete teleconsult. So these are things which are happening. And more significantly, it is 1.9 million NCD screenings. In wearables to invisibles, we found a way to monitor almost 40,000 people now using IOMT, and this number is growing every minute. But the important part is that if you're monitoring patients within the hospital, the number of code blues has dropped by 50% because our early warning symptom is sending the doctor and the nurse to the patient room even before he codes. Imagine this. Imagine if you could find sepsis in ICU, bloodstream sepsis, 2 days before it occurs, because your AI is being to analyze what are the early warning symptoms of sepsis. You will completely reduce the number of patients dying from sepsis. Many, many, many of these pathways are opening up to us when technology, human beings, and AI are working together. And this is the excitement. Whether it's in doing robotic surgery because it enhances precision, reduces blood loss, and uses the machine to help us. But then you go further, you go more, and we talk about AI and what it can do. I'm not going to share this entirely, but many of the team members talking at both the sessions, whether it's in the Transforming Healthcare with IT or the others. Last evening, we were having an interesting conversation on how do you ensure that your AI is validated. For now, the current standard, whether it's from ISO for AI as a medical device or from BSI, I just stated here about not more than 9, I'm sorry, 7, 10, 12 different AI algorithms where we've achieved the BSI registration. So you know that these are as safe as they can be in the current time. I'm very happy that over the period of the conference, we will be talking more about what we can do in deep learning. And here I have a significant announcement to make for our Honorable Minister and for the whole audience. The deep learning used for the detection of TB in X-ray. We built this along with Google. Google has handed over this algorithm to us, and this algorithm will be given completely free to all government hospitals, anybody who wants it, so that if you're doing any routine X-ray, we will automatically test for TB as well. And we will send this messaging. This is a promise and a commitment we're making because we need to work together. There are many, many more of these. This is also an ISO 13485 certified piece. The turnaround time in detection reduces. The AUC of an abnormal X-ray is coming to 0.94, which is among the highest that anyone has achieved in AI use in clinical. We're already using it in 4 centers and 2 rural centers, but I'm looking forward to this happening exponentially across, and therefore we're making this free. So please reach out to us, government, missionary hospitals, not-for-profit hospitals, even profitable hospitals. Let's find a way to work together because we're doing it for the patient. And solving TB is solving for the country and the world. We have many others. I'm not going to go into them, but DICOM for ECG is a very important one in terms of huge other interpretative care. Dr. Sujoy will be speaking a lot more on this. Many of these, this confidential computing in partnership with Microsoft. Anyone who's worried about how can I share my data, please go for the session on confidential computing. Your data is safe. We need to accelerate the pace of sharing. We need to accelerate and find ways, but I also think we need to change the dialogue. And the biggest one I'm going to give you on this slide of how do we do it is simply change the narrative. AI is not a substitute for doctors. AI is not a substitute for nurses, and I love you all the nurses in our audience. AI is only a complement. It's a tool. It's a methodology to enhance efficiency. So please adopt it. It will help us improve care. I'm not going into the regulation, the methodology, the usage, because there are deep sessions about this. I want to quickly, all of you who are saying all this is the tech stuff, I want to go deep down and say that tech and science are working together to bring this live to medical innovation. And therefore, if you're talking about immunotherapy, whether it's checkpoint inhibitors or malignant melanoma treatment, lung cancer, renal cell cancer, each one of these now have new cures come because of immunotherapy. Further, the CAR T cell therapy is going to change the way we're looking at treatment, and tumor inflation, lymphocytes, many of these can be changed by using immunotherapy. There's a lot more of this science to evolve. I'm happy that Kiran is sitting here in the audience. She has an original company that she's put forward in this area, and again, we're going to request her to be speaking about this further. Finally, moving on, things like gene editing and CRISPR are real and happening today. Nanotechnology is being used to create new drugs, to improve drug delivery systems, to treat cancer and HIV. But we need to work together. There is more research to be done. The reason I'm bringing this forward is simply to say, please let's understand how science is working for us. How many cancer patients who could be treated with proton are being denied that care? Let us collaborate. Let us reach out to each other and ensure. Because the diameter of science is just moving closer and closer to us. I'm saying synthetic organs here, and many of you may be thinking, she promised to talk only about reality. Believe me, they have already done lung transplants using synthetic organs. This is 3D printed scaffolding with stem cell therapy on top of it. And this stem cell and 3D can change the availability, because all of us know people who are dying because we don't have access to an organ. How can we accelerate this pace of discovery by working together? And now I'm shifting gear. It's not just about treating the very sick of cancer and organ and transplant. This is about keeping people healthy. How can we move from reactive care to preventive care? How can we enhance using our knowledge of the gene, do personalized medicine? This wonderful old lady, we're figuring out whether she needs a cataract, but Google already promised us that the eye images can tell you about her cardiac problems. These are happening. These are realities. How can we jump onto this? I'm sharing a very important project here, once again requesting that all of us can work together. This is a project which is happening in Singapore called Project Reset. Because cardiovascular disease, heart failure, stroke and diabetes are the tip of the iceberg that you see on top. Underlying factors, arterial stiffness, hyperlipidemia, insulin resistance are accelerating these. We need AI models, clinical markers, biological markers to enhance the sharpness of the diagnostic that we're doing. This is a project being done in Singapore, and they have just reached out to us to find ways to partner. So I look forward to all of you writing to us and saying, let's do this together as a country, let's do this together as the world, because if we can reduce non-communicable disease, we can bring back families, or we can keep families together, we can prevent early deaths, and we can reduce healthcare costs. Many things to be done. A small plug on what we are doing in preventive healthcare. At Apollo Pro Health, we currently are doing about 1.5 million checkups a year. Our chairman has asked us to do 3 million, which we're committed to. If all of us come together, we can make that 30 million. The Pro Health starts with an AI-enabled risk scoring, a personalized set of tests which is relevant for you, a one-time testing of genetic makeup, an interpretation of that, and finally a path to wellness, and then a CRM-based monitoring and nudging on 24/7, or you can put it on your own platforms. But please, let's find ways to keep people healthy. This is this plea and this call. I will end by saying that I believe there's some imperatives for us for today and tomorrow. And I tried to make all this really simple. Number one is to prioritize preventive care. Number two is to set up your digital environments. And Dana said this. This digital is the foundation. Promote interoperability, use standards, start data sharing. Finally, create continuous learning organizations, because what your doctors are doing today is not enough for what patients need tomorrow. We have to keep learning. Our learning platforms must improve. And again, none of us are an island. We cannot do it ourselves. Collaborations. Yesterday, I had the privilege of spending some time with the minister, and he told us about the new science policy he's bringing forth. 70% of the science policy is inviting private sector to work with government organizations. Please give him a big hand for his innovation in science, being a physician himself, and a very, very talented clinician at that. He knows how we can bring these together. I'm deeply privileged to have him at our conference. He left a hectic series of work to fly in specifically to speak to all of us today. Minister, we want to thank you for being with us. So collaborative innovation is finally the name of the game. And like my sister Preeta rightly said, and like our chairman said, we are proud to be Indians, and we are global citizens. So may I, in addition to all the mega trends we spoke about, share with you one more. And please note this. Heal in India. The number of patients traveling to India for treatment will increase. Heal from India. Remote care will enable rural areas across the world, underserved areas in Africa and other parts, areas where you have manpower shortage. Remote care devices and the Internet of Medical Things will transform and enable us to get into homes and help people, whether they're elderly or sick, monitor their care. We will heal from India. And finally, we will heal by India, because a 17 million healthcare workforce shortage and the demographic of India with young people and the tremendous policy changes in enhancing medical colleges, medical education will all come together to help us to serve the world. This is our legacy. This is a trend which is being lived out today. So please join this. And finally, may I end with where I began. The things are moving really fast. Everything is happening. So please let these 2 days be the beginning of a new jet fuel that you put into your engines, because the old fuel we were using is just not fast enough. And let's continue to be inspired by our vision of health equity, of healthy, happy people, of improved access, of improved quality, and of reduced costs, so that everybody can find a way to afford care, to access care, and access good quality care, because you, the healthcare workers, you, the healthcare leaders, are dreaming, designing, inspiring, and committing to a better healthcare world. I end where I always began, first with a confession. All the slides you saw till this one were created by ChatGPT in 15 minutes. All those slides were made by ChatGPT. But this slide, which is my last one and a favorite, is that Dr. Reddy always says that of all the awards he's got in his life, the one which was the most precious was the Humanitarian Award. And Mother Teresa telling him that you are here in the service of mankind, and therefore may God bless you. This message is for all of you. May God bless you all. Thank you for your friendship and your partnership.